The FDA has just approved a drug called Andexxa, and it's meant to stop uncontrolled bleedings in conditions like a stroke or pulmonary embolism. It certainly can save lives, and joining us to talk about it now is Dr. Mark Alberts. He's the physician-in-chief of the Ayer Neuroscience Institute at Hartford Healthcare. Happy to have you here, Doctor. A pleasure to meet you, sir. Yeah, glad to have you here. And this is a very exciting treatment, not just because it can save lives, but because Hartford Healthcare has it. We'll get to that, but why don't you tell people about the drug itself?
Right, so this drug really just got FDA approved a few weeks ago, and it's for patients taking two powerful blood thinners, Eliquis and Xarelto, that your viewers may have heard about because it's advertised on TV.
Yes.
And these are great medications, don't get me wrong. They help prevent stroke in people with atrial fibrillation and blood clots in the legs and things like that. But in a small percentage of cases of patients taking this drug, they have serious bleeding into their brain, into their stomach, somewhere else. And Andexxa is the first and so far only FDA-approved medication that's been shown to stop or arrest this type of bleeding for folks taking these medications.
And that's a very specific type of bleeding you're talking about here with people in Eliquis and Xarelto. Does it just work for that, or does it work for other cases where there might be uncontrolled bleeding?
Really just Eliquis and Xarelto.
Okay.
It's a sort of a neat compound because it reverses the effects of that by sort of tricking the drug to bind to it instead of the normal clotting factor. So it's really neat how it was genetically engineered to do that.
And because it was genetically engineered, this is not something that's very common at this point.
No, it's actually very difficult to manufacture. It's a complicated manufacturing process, and that's why there's a national shortage of the medication. So only very few hospitals in the entire nation have this medication to use. And
Hartford Hospital is one of them.
Hartford Hospital is one. We've treated a handful of patients since its approval. And what we found that is in about 80% of patients, it works like it's supposed to in terms of stabilizing the bleeding, stopping the bleeding, and the patients have a good outcome.
How quickly does it manage to work? I mean, I imagine it has to work quickly because you don't have a lot of time, right?
It does. Once it's given, and it's given intravenously, it starts reversing the blood thinning effect of the Xarelto or Eliquis within minutes.
Wow.
So it really is a very rapid effect.
That is fantastic. You mentioned Hartford Hospital has it. What was the decision process? I mean, why was Hartford Hospital such an attractive option to give this to?
Right. So when the company Portola was trying to decide which hospitals would have this medication, they looked for hospitals that would typically have a lot of patients who would need it, like bleeding in the brain, bleeding in the gut, stroke. We're a comprehensive stroke center. We're a level 1 trauma center. So we attract patients who may have bleeding and who could benefit from this medication.
And there you go. Yes, nothing against Xarelto and Eliquis. Those are wonderful medications, and now they're even safer thanks to Andexxa coming out. Doctor, thank you so much for having us here.
Thanks so much for having me.
Please, a pleasure, a pleasure. Let's